Hello, I'm Dr. E. Barry Gordon, and this is the second in my series of informative videos about testosterone deficiency, an extremely common, an extremely serious, and an extremely ignored disease. Who should be interested in testosterone deficiency? Who can it affect? The answer is all adults. The only ways to avoid the consequences of testosterone deficiency are to be treated or to die young. Women suffer more severely from the effects of testosterone deficiency and begin to do so at a younger age. Studies have shown that women start to lose adequate levels of testosterone between the ages of 25 and 35. As a result, most women become symptomatic of the disease about 10 years later, between 35 and 45, and virtually all are suffering from testosterone deficiency by their 50s. It's not uncommon, however, to find women with symptoms and laboratory evidence of testosterone deficiency as young as their 20s. If anyone has doubts about these ages of testosterone loss, just check any reputable website dealing with osteoporosis. They'll all tell you that most women reach their peak bone density around the age of 30, after which they start the process that eventually leads to osteoporosis, one of the many consequences of testosterone deficiency. For men, simply add about 5 to 10 years to those numbers. There's more specific documentation for the male sex. A 2006 study out of the University of Florida showed that 4 out of 10 men over 45 were deficient in testosterone. Having quoted that University of Florida study, I believe it severely underestimated the actual number of men deficient in testosterone at that age, contrary to the popular misconception that testosterone deficiency is a problem affecting the elderly. It is not at all uncommon to find men in their 20s, and many more in their 30s, who are lacking adequate amounts of the hormone. One of the reasons for this gross underdiagnosis is that very few doctors look for the disease. Another is that the laboratory reference ranges used to diagnose testosterone deficiency by those doctors who do order the tests are seriously flawed. I should add here that I believe it is not at all rare for some men and women, or perhaps better said, boys and girls, to never produce quite enough testosterone, to never have a truly adequate amount in their body. As a result, they never fully complete puberty. While they are physically developed and appear to be healthy, they never reach full mental and sexual maturity and are doomed to live much less than fully satisfying lives. I'll be discussing this idea in detail in a future video. With so many people having this disease, the next question is, what exactly are the medical problems caused by testosterone deficiency? There are those that have been generally accepted by the medical community: chronic fatigue, weakness, loss of libido and sexuality, anemia in older women, and a tendency towards erectile dysfunction. Then there are the testosterone deficiency-related diseases that have abundant documentation in published medical studies. These include depression, type 2 diabetes, coronary artery disease, osteoporosis, congestive heart failure, peripheral vascular diseases, and senile dementia, senility. Published studies also provide a very strong case for testosterone deficiency being a major cause of prostate cancer, and even, I believe, breast cancer. One extremely important and meaningful aspect of the disease that has been shown in recently published studies by several major institutions is that the more testosterone in a man, the longer he lives. I'll relate some details of these studies in the next video. I also believe that testosterone deficiency plays a major role in pneumonia of the elderly, in asthma, and the symptoms of advanced chronic lung disease, such as emphysema. And finally, I have suspicions that testosterone deficiency may be involved in some cases of recurrent miscarriages and gynecological malignancies. And I wonder about the effect testosterone deficiency has on our immune system, on the degeneration of our joints as we age, on the strength of our intervertebral discs, on constipation in the elderly, and even on some forms of seizure disorders. All of these diseases, conditions, beliefs, and speculations, and how they relate to testosterone deficiency, will be discussed in detail in separate videos. as will even more conditions that I have seen favorably affected by testosterone replacement, such as a marked increase in the amount of iron absorbed from iron pills. The fact is that there are so many people affected by testosterone deficiency, and there are so many diseases and conditions that have some of their roots embedded in testosterone deficiency, that it is the most serious disease to affect us, at least in the Western world. And I'd be very happy to debate that statement with anyone. Again, I invite you to visit my website, www.thehiddendisease.com. Aside from all previously released videos and a lot of other information, I've posted the abstracts of over 70 published medical studies. Most of these are from major institutions like Harvard, Columbia, Case Western Reserve, the universities of Arizona, Florida, and both the Los Angeles and San Diego divisions of the University of California, among many others. Many studies come directly from the National Institute of Health. And there are more studies on my website from Johns Hopkins than any other institution. The next several segments will deal with various facets of testosterone and its deficiency state. I'll discuss the nature of the hormone, what it is, where it's made, what it does. I'm also going to examine this question. Is there any basic, fundamental biological reason to believe that the loss of testosterone affects our health, our survival? I'll be discussing in detail some of the subjects I mentioned today, why so many doctors are so rigidly blind to what is actually right under their noses, and the very serious problems with the laboratory diagnosis of the disease. You'll learn how to be certain of getting the right blood test done and of having the proper interpretation. Then there'll be a series of videos dealing with all the diseases and conditions I've mentioned. The various treatment options will be discussed, which work the best and why. I'll tell you case histories, what I've seen happen to patients once their testosterone is restored. Some of them will be very hard to believe. I plan to end this educational program by having you see and hear many of my patients so they can tell you directly what testosterone replacement has done for them and for their lives. Not much time will be spent discussing adverse side effects of properly replacing testosterone because, despite what most people and most doctors believe, there really aren't any. The next video, number 3, will deal with the nature of testosterone, what it is, where it's made, its importance. Finally, as I'm going to ask at the end of every segment, if you think the subject of these videos is of any value, do your friends and relatives a big favor. Tell them about it. Show them the videos if necessary. And please, help me educate the country by emailing these videos to everyone in your address book and ask them to keep the ball rolling. I'm Dr. E. Barry Gordon. Thank you for watching.